Dementia is a term that describes a decline in mental abilities, such as memory, thinking, and reasoning. It can affect anyone, but it is more common in older adults. Dementia can have many causes, such as Alzheimer's disease, stroke, Parkinson's disease, or brain injury. It can affect different aspects of a person's life, such as their mood, behavior, communication, and daily activities. Some of the signs of dementia are obvious, such as memory loss, confusion, or difficulty finding words. But some of the symptoms are more subtle and may go unnoticed for a long time. These are called silent symptoms of dementia. Silent symptoms are those that do not cause obvious problems or distress to the person or their loved ones. They may seem like normal changes that come with aging or stress, but they can indicate that something is wrong with the brain and that the person may need medical attention. In this video, we will reveal 8 silent symptoms of dementia that you should be aware of. Knowing these symptoms can help you detect dementia early and seek treatment or support. Early detection can also help you plan for the future and make the best decisions for yourself or your loved one. So, let's dive in. Number 1. Changes in personality or mood. This means that the person may act differently than they used to or have sudden shifts in their emotions. For example, they may become more irritable, anxious, depressed, or apathetic. They may also lose interest in things they used to enjoy or become more withdrawn from social activities. These changes can be caused by damage to the parts of the brain that control emotions and personality. They can also be a result of frustration, fear, or confusion caused by memory loss or other cognitive difficulties. Number 2. Difficulty with complex tasks. This means that the person may have trouble with tasks that require planning, organizing, problem-solving, or multitasking. For example, they may struggle with managing their finances, following a recipe, or driving a car. These difficulties can be caused by damage to the parts of the brain that are responsible for executive functions, which are the mental skills that help us plan, prioritize, focus, and control our impulses. They can also be a result of reduced attention span or concentration caused by dementia. Number 3. Trouble with spatial awareness. This means that the person may have difficulty with judging distances, directions, shapes, or sizes. For example, they may bump into things, get lost easily, or have trouble reading maps or graphs. These problems can be caused by damage to the parts of the brain that process visual information and spatial relationships. They can also be a result of impaired vision or hearing caused by aging or other conditions. Number 4. Language difficulties. This means that the person may have trouble with finding words, understanding what others say, or expressing themselves clearly. For example, they may use the wrong word, repeat themselves, or speak in a vague or nonsensical way. These difficulties can be caused by damage to the parts of the brain that are involved in language production and comprehension. They can also be a result of reduced memory or attention caused by dementia. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 5. Changes in sleep patterns. This means that the person may have trouble falling asleep, staying asleep, or waking up. They may also experience changes in their sleep cycle, such as sleeping more during the day and less at night. They may also have vivid dreams or nightmares. These changes can be caused by damage to the parts of the brain that regulate sleep and circadian rhythms. They can also be a result of anxiety, depression, pain, or medication side effects caused by dementia or other conditions. Number 6. Loss of smell. This means that the person may have difficulty smelling things or recognizing familiar odors. For example, they may not notice if something is burning, spoiled, or fragrant. This symptom can be caused by damage to the parts of the brain that are connected to the olfactory system. The olfactory system is the sensory system that allows us to smell things and associate them with memories and emotions. Keep in mind here that loss of smell can also be a result of nasal congestion, allergies, infections, or aging. Number 7. Changes in appetite or taste. This means that the person may eat more or less than usual or have different preferences for food and drinks. For example, they may crave sweets, salty foods, or spicy foods. They may also lose interest in food altogether or forget to eat. These changes can be caused by damage to the parts of the brain that control hunger and satiety. They can also be a result of changes in smell, taste, mood, or medication effects caused by dementia or other conditions. Number 8. Lack of insight. This means that the person may not realize that they have dementia or that their abilities have declined. They may also deny or minimize their problems or blame them on others. For example, they may insist that they are fine, that they don't need help, or that someone else is stealing their things. This symptom can be caused by damage to the parts of the brain that are involved in self-awareness and reality testing. It can also be a result of fear, embarrassment, or denial caused by dementia. Now, what to do if you notice these symptoms? Well, if you notice any of these silent symptoms of dementia in yourself or someone you care about, don't ignore them or dismiss them as normal aging. They could be signs of a serious condition that needs medical attention and treatment. The first step is to talk to your doctor and get a thorough evaluation. Your doctor will ask you about your medical history, your symptoms, and your daily activities. They will also do some tests to check your memory, thinking, language, and other cognitive skills. They may also order some blood tests, brain scans, or other exams to rule out other possible causes of your symptoms. The second step is to get a diagnosis and a treatment plan. Depending on the cause and type of your dementia, your doctor may prescribe some medications, therapies, or lifestyle changes to help you manage your condition and improve your quality of life. They may also refer you to some specialists, such as neurologists, psychiatrists, psychologists, or geriatricians, who can provide more specialized care and support. The third step is to get help and support from others. Dementia can be a challenging and isolating condition, but you don't have to face it alone. There are many resources and services available to help you cope with your symptoms and live well with dementia. You can reach out to your family, friends, neighbors, or community groups for emotional and practical assistance. You can also join some support groups, online forums, or educational programs for people with dementia and their caregivers. You can also contact some organizations, such as the Alzheimer's Association or the Dementia Society of America, for more information and guidance. At the end, remember that dementia is not a death sentence. It is a condition that affects millions of people around the world and can be managed with proper care and support. By knowing the silent symptoms of dementia and seeking help early, you can make a difference in your life and the lives of those you love. Now we want to hear from you. Did you or someone you know experience some of these symptoms before? Was it actually dementia or other condition? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.